Welcome to this video in the Emergency Medicine Consultant series, focusing on general orthopedic principles. This material integrates content from Tintinali and Rosen and was prepared by Dr. Nasser Hassan, EM Consultant. We begin with the orthopedic foundation, establishing a systematic approach for evaluating and managing musculoskeletal trauma in the emergency department. A critical first step is the neurovascular examination, which assesses circulation through distal pulses and capillary refill to rule out ischemia. It also includes systematic motor function testing and sensory mapping to identify nerve impingement. Physical exam axioms guide our assessment. We use look, feel, move to check for deformity, tenderness, and range of motion. Importantly, we must always examine the joint above and below the injury. The principles of splinting involve immobilization to reduce pain and prevent further damage. Padding is essential to prevent skin breakdown over bony prominences. Remember to always use non-circumferential splints in the ED to accommodate swelling. Compartment syndrome diagnosis is clinical, often signaled by pain out of proportion. We monitor the clinical 6 petaseconds: pain, pallor, pulselessness, paresthesia, paralysis, and poikilothermia. A delta pressure of less than 30 millimeters of mercury suggests the need for surgical intervention. Understanding fracture description syntax is crucial for communication. This table outlines components like type, location, displacement, angulation, and rotation, along with their clinical significance. When dealing with open fractures, the Castillo-Anderson classification correlates the severity of the injury with the risk of infection. Upper extremity trauma is frequent in the ED, with distal radius fractures being the most common, followed by clavicle, proximal humerus, and scaphoid injuries. Immediate open fracture management begins at T=0 with IV antibiotics and tetanus prophylaxis. Gross irrigation and sterile dressing follow at T+1 hour, targeting formal operative debridement within 6 hours. When ordering imaging, apply the rule of twos. Ensure 2 views, image 2 joints, repeat films on 2 occasions if needed, and compare 2 limbs if the diagnosis is unclear. This concludes our video on general orthopedic principles. Thank you for viewing this clinical discussion, which utilizes references from Tintinali's 9th and Rosen's 10th editions. These are the sources for the images used in this video.